Walking into work at the Royal Hobart Hospital, staff are well aware of what awaits.
Unfortunately, in the Royal Hobart Hospital, it's coming a business as usual that we at least have every evening, going on to night duty, at least 20 patients waiting for beds.
Staff shortages, insufficient beds, ramping and growing demand are continuously adding to the pressure.
We've had almost permanent bed block for the last 10 years, and we essentially don't have enough capacity to meet the demand of the community.
That situation became critical last weekend. A text message was sent out to staff describing significant pressure.
The overcapacity emergency department, the amount of ramped patients, admitted patients not being able to go into beds and those in the waiting room.
Unions wanted a code yellow called to alert the community to the situation and to activate a whole-of-hospital response, but this didn't happen.
Our members feel that they were operating in code yellow, circumstances, and would really like to understand why that wasn't called in at that time.
The Health Department says it didn't receive a request from the hospital to implement a code yellow. It was already at a high escalation level, and this was seen as adequate. But staff say a code yellow was discussed widely at the time and wasn't actioned upon. The Royal Hobart isn't the only Tasmanian hospital facing increasing pressure. The percentage of patients seen on time at the Launceston General Hospital has dropped to 37%, almost as low as Hobart.
The LGH, we've got paramedics being ramped there every day and for hours at a time. Instead of being able to go to calls in the community, paramedics are getting stuck at hospital pretty much every case they take there, with a few exceptions, which means they're just not available to respond.
The matter will soon face greater parliamentary scrutiny. A ramping inquiry was agreed to last month, with the public able to provide stories and solutions.
I have been overwhelmed with people contacting me personally, paramedics, nurses, patients and families already wanting to share their stories.
The government says it looks forward to reviewing suggestions made during the inquiry. Adam Holmes, ABC News.